Cerebellum and the ventricular system. First, we are starting with the cerebellum anatomy, which is the meaning the little brain. This is at the base of the brain in the posterior cranial fossa, below the tentorium and behind the sternum, brainstem. The cerebellum has the following features: three surfaces, which is anterior, called petrosal, superior, called tentorial, and the inferior, suboccipital. It has three fissures: primary tentorial, horizontal fissure, and the prepyramidal fissure, two hemispheres, and single median vermis. Lies above and behind the medulla and pons, and occupies the posterior cranial fossa. Its relation anteriorly, as there is in the picture, fourth ventricle, pons, and medulla. Posterior inferiorly, occipital bone, while superiorly, tentorium cerebri. As in this diagram showing also fornix, penile body, superior and inferior colliculi, cerebral aqueduct between the third and the fourth ventricle, and then a central canal of the spinal cord. It has two deep fissures, which is the primary fissure and a posterolateral fissure. Three lobes divided into three lobes, which is the anterior and the posterior and the folliculo-nodular lobe. This is from the posterior view, anterior lobe and the posterior lobe in between primary fissure. From the anterior view, anterior lobe, posterior lobe, and the folliculo-nodular lobe, posteriorly posterolateral fissure. Sagittal section, anterior lobe, posterior lobe, folliculo-nodular lobe. Also, it's like a brain, cortex, and medulla, and connected to the midbrain and pons by three peduncles: superior, middle, and inferior peduncle. This is medulla. And this diagram showing also the choroid plexus of the fourth ventricle. So the fissures dividing the cerebellum to two lobes, anterior lobe, which is subdivided to the culmen, and central lobe, and posterior lobe is subdivided to declif, folium, and then horizontal fissure, then tuber, prepyramidal fissure, pyramid, and uvula, and the most inferior part, which is tonsils. Connection of the cerebellum, it has, as we said, three peduncles. Inferior peduncle, also called restiform body, connects the posterolateral part of the medulla with the spinal cord, contain both afferent and efferent fibers. Middle cerebral peduncle connects with pons, contain afferent and efferent fiber. It is fiber which arise in the pontine nuclei close to the opposite side. It means that the one hemisphere of the cerebellum controlling the ipsilateral side of the body. Superior cerebellar peduncles connects with the midbrain, contain mostly afferent fibers, consist mainly of fibers arising in the cerebellar nucleus, mainly dentate nucleus. The right and left peduncles are connected by the lamina of white matter, the superior medullary velum. Internal structures, as we said, is like a brain, so it consists of cortex and inner medulla, cerebral cortex and the cerebellar nuclei, which is the dentate nuclei in this part, and emboliform nucleus and interposed nucleus, which is composed of emboliform and globus nucleus, and the white matter of medullary center. And this diagram also showing the superior, middle, and inferior cerebellar peduncles with its nucleus, vestigial, interposed nuclei, and dentate nuclei. This is also the superior peduncle, inferior peduncle, and the middle cerebellar peduncles. It's connected to the bones, and here we have trigeminal nerve and the vestibulocochlear nerve, which is going to the olive and pyramids. So principal input to the cerebellum, it is from the cerebral cortex to the bones, then to the cerebellum, to the vestibular inputs, olive, and spinal cord. And principle of output is from the cerebellar cortex to the deep nuclei, to the thalamus, and to the cerebral cortex. So its function, posture, and head position, gait, and eye movement. Vermis, the cerebellar vermis, is located in the midline, separating the two cerebellar hemispheres. Its organization mirrors the adjacent hemisphere divided into 9 lobules. Cerebellar hemisphere, just like a vermis, each hemisphere is divided into 9 lobules separated by fissures. So, subdivision of the vermis is also the same of the cerebellum, which is subdivided accordingly to the cerebellar lobules, like lingula, central, culmen, declif, and pholum, tuber, and pyramid, uvula, and the nucleus also. This diagram showing the lobules, central lobules, culmen, primary fissure, declif, pholum, horizontal fissure, tuber, prepyramidal, and pyramid, secondary fissure, and the uvula, and the nodule lobe. So it is corresponding to the parts of the vermis as it is shown in this diagram. So it is a lingula, central lobe, culmen, declif, and pholum, tuber, pyramid, uvula, and nodule with the flocculus, which is forming floccular nodular lobe. This is the same from the anterior and the posterior view. Arterial supply to the cerebellum, superior cerebellar artery, is the branch of the basilar artery supplying the superior surface of the cerebellum. And inferior cerebellar artery, which is the anterior and posterior. Anterior, which is the branch of the basilar, also branch of the basilar artery, supply the anterior part of the inferior surface of the cerebellum, while the posterior inferior, which is the branch of the vertebral artery, and supplying the posterior part of the inferior surface of the cerebellum, as it's showing in this diagram. This is superior cerebral artery and the inferior cerebellar artery, which is the anterior inferior, and this is the posterior inferior, which is the branch of the vertebral artery, and the superior and anterior inferior, which is the branch of the basilar artery. CT scan used to detect infarction, tumor, calcification, and hemorrhage. In this procedure, X-ray beam traces an arc at the multiple angle around a section of the head, resulting in transverse section produced by the computer on its monitor screen. Generate 3D view, hypodense, which is mean dark, and hyperdense bright appears, as it is shown in this CT scan of the cerebellum, showing the cerebellum and its content pathology. MRI provides superior imaging than CT scan, used to confirm diagnosis of a neoplasm vascular disease, posterior cranial fossa lesion, cervicomedullary lesion, or intracranial pressure disorder. Body is exposed to high magnetic field, which permits protein in tissue to arrange themselves in the related field. Then a pulse of radio waves relates this ion pattern and colored image in form on the monitor. No risk of ionizing radiation. As it is shown in this nice diagram, just showing cerebellum, vermis, and the fourth ventricle anterior to it, inferior cerebellar peduncles, medulla, just connecting to the medulla, and more anteriorly we have basilar artery, laterally internal auditory canal, and the cochlea. This is a cerebellar hemispheres, cerebellar tonsil, which we said is the most inferior part of the cerebellum, and the midbrain medulla, and basilar artery and carotid artery on each side, and clevis between. Diagram of sagittal section. This is cerebellum, and this is for ventricle. Anteriorly, we have medulla, pons, and midbrain. Superior to it, thalamus, lateral ventricle, corpus callosum, and the lobes of the brain. This MRI of the cerebellum showing pathology in the left cerebellar hemisphere. And we have variant anatomy like cerebellar agenesis, as you see, not present in this MRI, and also tonsillar ectopia, asymptomatic protrusion of the tonsil through the foramen magnum by no more than 3 to 5 mm. This is tonsillar ectopia as shown in the sagittal section. Now we are moving to the second part, which is the ventricular system. The ventricular system in the brain is composed of CSF, cerebrospinal fluid, filled ventricles, and their connecting foramina. CSF is produced by the ependymal cell which line the ventricles. They are continuous with the central canal. Ventricles contain around 20% of total average adult CSF volume, around 20 to 25 ml. The ventricular system consists of two lateral ventricles, a midline third ventricle, and a fourth ventricle. As you see now in this diagram, we have the two lateral ventricle and third ventricle cerebral aqueduct transmitting to the fourth ventricle, and through a central canal going to it's connected to the subarachnoidal space and surrounding the brain. Anatomy of the lateral ventricle. We have two lateral ventricles, and it's the C shape, largest cavity, three extensions, anterior, which is in the frontal lobe, and posterior in the occipital lobe, inferior in the temporal lobe, and interventricular foramen or foramen of Monro, which connects it to the third ventricle. This coronal section also showing the ventricles coronal section. This is corpus callosum and the lateral ventricle, and between its fornix and the third ventricle. And laterally we have corpus callosum. Interconnection between the ventricle occurs through the following. Interventricular foramen called foramen of Monro. It is located lateral to the third ventricle. As you know, the lateral ventricle connecting to the third ventricle from interventricular foramen, and then to the fourth ventricle through the cerebral aqueduct, and then going to the central canal. So cerebral aqueduct connecting the third to the fourth, median aperture of Magendie falls to cisterna magna, two lateral aperture of Luschka falls to the cerebropontine cistern. Both the cisterna magna and the cerebellopontine cisterns are in the subarachnoidal space. This space is continuous with the subarachnoidal space around the cord down to the level of the coda equina. This is the lateral ventricles. Lateral ventricle, anterior horn of the lateral ventricle, body of the lateral ventricle, atrium, occipital horn, and it is inferior or temporal horn. And this is the third ventricle, which is connected to the lateral by interventricular foramen, two interventricular foramen on each side. This is the third, and this is an interthalamic adhesion in central, and it's connected to the fourth ventricle by cerebral aqueduct. And as we said, we have two lateral aperture and a median aperture. Major CSF production coming from the choroid plexus found in the lateral ventricle and third and fourth ventricle of the brain, which are highly vascularized epithelial tissue masses. Notably, choroid plexus is not found in the frontal or occipital horn. It's not found in the frontal and occipital horn of the lateral ventricle, nor in the cerebral aqueduct, but it's present in the body and third and fourth ventricle. The diagram showing the choroid plexus. This is corpus callosum, septum pellucidum, and the third ventricle. This right area is the choroid plexus, and this is the choroid plexus of the fourth ventricle. Third ventricle, the third ventricle located centrally. The lateral ventricle connected to the lateral ventricle with the small hole on each side, foramen of Monro. This is the lateral ventricle. CT axial section at the third ventricle, showing from anteriorly genu of the corpus callosum. This is frontal horn of lateral ventricles, caudate nucleus, internal capsule, lentiform nucleus, and the third ventricle. And this is pineal gland, and this is the dermis of the cerebellum, and this area is occipital lobe, and this white area or choroid plexus on each side. Axial section at the mid ventricles, showing body of the lateral ventricle and pineal body and occipital horn of lateral ventricle. MRI showing the cerebellum on each side and the fourth ventricle in central with a choroid plexus on each side and intercerebellar vermis. And anteriorly, we have basilar artery. Sagittal section showing body of the corpus callosum and genu and lateral ventricle and connected to the third ventricle for quadrigeminal cistern, then to the fourth ventricle, then to the central canal. Coronal section at the third ventricle, showing the frontal horn of the lateral ventricle, fornix, and the third ventricle, interpedunculaire cistern, and the clavus, and the odontoid process inferiorly. About the ultrasound of antenatal ultrasound, showing the lateral occipital horn of the lateral ventricle, lateral wall of the lateral ventricle, and the medial wall of the lateral ventricle, choroid plexus in the atrium of lateral ventricle. This is the anterior fossa. And this picture showing the dilated ventricle in the fetus. And this is a white area, gray tissue, and a bone within the amniotic fluid. And it's finished. Thank you so much.
عشت ايدك دكتورة غازان for this nice lecture. اكو احد عنده سؤال اضافة حول السيربيلم والفنتريكولار سيستم؟
العفو استاذ، العفو استاذ. السب ديفيجن مال السيربيلم مهم
بل.
نحفظهن هاي الديكليف والفوليوم والتيوبر وهاي الاسماء يعني.
لا بس واحد يطلع عليها، بس واحد يطلع عليها.
تمام، شكرا جزيلا.
اذا نروح على نور محمد جواد.
نعم أستاذ. رقم 1 هي السوبراسيلر سيستم.
سوبراسيلر سيستم. عبد الكريم ناهل.
أستاذ رقم 2 بونتاين سيستم.
الصوت مو واضح دكتور عبد الكريم.
بونتاين سيستم.
بل. أحمد خليل.
نعم أستاذ. نمبر 3 كيفم فيلم انتربوزيتم.
كيفم سلم انتربوزيتم. اوكي. نروح على دكتورة دعاء. نمبر 4
quadrigeminal system.
quadrigeminal system. حيدر كريم. نمبر 5.
نعم أستاذ. interpedunculaar system.
interpedunculaar system. وليندا لواء أخير واحدة. نمبر 6.
نعم أستاذ. cisterna magna.
This is the cisterna magna. اوكي. عندك بعد دكتورة غازان؟
نعم دكتور.
أستاذ محمد. أستاذ محمد. أستاذ محمد ويانا؟
عندي أستاذ رعد وياك حبيبي.
يلا هذه الكوز السكند بارت.
شيماء علاء رقم 1.
نعم أستاذ. انتر هيمسفيريك فيشر.
انتر هيمسفيريك فيشر. زين. زهراء صباح.
نعم أستاذ. نمبر 2 كوربس كولوزم.
زين. صفا شامل رقم 3.
نعم أستاذ. الانتيرال هورن اوف lateral ventricle left side.
علي حسين مصطفى 4.
نعم أستاذ. هذا سبتم بالوسيدم.
5 لارا نصير.
نعم دكتور. Choroid Plexus marking the interventricular foramen.
آخر وحدة عمر.
نعم أستاذ. third ventricle.
third ventricle.